And why PCIT in Southwest Sydney?
So Southwest Sydney is what's known as a vulnerable community, which means that within this area there are certain pockets of disadvantage. We know that certain families, groups or communities suffer things like financial instability, unemployment, poor mental and physical health, and less access to preventative services, more when compared to the rest of New South Wales. And while we know that there are services available to these families, there are also a certain number of things that get in the way of families accessing these services. So these barriers include things like the cost of treatment, how expensive treatments are. They also include things like families' lack of awareness that services even exist, or a lack of understanding about how the services work or how they can help, even if families do know that they exist. It's also often really difficult to get to a clinic, particularly when there's more than one child in the family and services are only offered within office hours. We also know that many of the services aren't culturally sensitive and don't take certain things into account, and that these things can stop families from accessing services too. Which is where our project comes in. And what we're hoping is that by delivering PCIT in schools, we can start overcoming some of these barriers and increase the accessibility of PCIT to families who could really benefit from it. So for example, by doing PCIT in schools, we hope that the service becomes more accessible because there are more workable office hours, for example. We can do treatment sessions before school or after a work day. There's also more scope for childminding services available on site at the school. We also hope that the service will be less stigmatizing because the school environment's more familiar and it's less intimidating going to a school than going to a mental health care clinic, for example, which hopefully means families are more comfortable. And finally, we hope that the financial burden of accessing a treatment will be significantly reduced, given that this is a no-cost service.